Kara, are you Sherry's replacement?
I am.
Well, welcome. It's nice to have you.
Thank you.
Okay, I think we are waiting for one or two more folks, but we'll go ahead and get started. So we'll do a quick round of introductions. I am Trista Lawrence. I'm the Coordination Administrator here at UTA in the Coordinated Mobility Department. And Glenn, did you want to go next?
Happy to. I'm Glenda Clausen. I work in the Coordinated Mobility Department at UTA as the Grants Compliance Officer.
Miss Tracy.
Hello, I'm Tracy Young, the Grants Director at UTA. And Kara, I used to be the Foster Grandparent Program Coordinator in Davis County years ago. So
Awesome.
I know what you do.
Okay, Christy.
Hi, I'm Christy Allen. I am the Coordinated Mobility Manager.
Lydia.
Lydia Robertson with Turn Community Services.
John.
I'm John with United Way down here in Utah County, working with mobility management and Utah Valley Rides and any other projects that seem to come up rapidly.
Alika.
Hi, I'm Alika Lindsay with Utah Transit Authority. I am the Coordinated Mobility Grant Administrator for the FTA 5310 grant.
Gary.
I'm Gary Tippett. I'm with United Way of Utah County down here in Provo.
John, or no, sorry, Jay.
Jay Wacker, Yellow Cab Utah, Ute Cab Company.
Anna. Oh, you are muted, I believe.
Can you hear me now?
Yes.
Okay. Hi, I'm Anna, and I'm with the Payson City Senior Citizens.
Thank you. Kara.
I'm Kara Moody. I'm with Utah County Senior Volunteers. We have the Foster Grandparent and Senior Companion programs, and I'm replacing Sherry Tuckett, who you may all know.
Thank you. And Tom, we're just doing quick introductions and who you're with.
I'm Tom Hogan. I'm with Community Action Services and Food Bank in Provo.
Great. Thank you for joining us.
Thank you.
Okay. So welcome new folks and new attendees. We're glad you're here, especially for Utah County. We love to see this area growing with partners. So I'm going to do a quick safety message. This is something we're going to start doing at each meeting. Sometimes they may be related to transportation specifically. Sometimes they just might be related to things you might encounter in the workplace. So the safety message this month is safety in using a stepladder. When using a stepladder, don't let a misstep lead to a mishap. So inspect the ladder before use and check for damage, loose rungs, or faulty locking mechanisms, and don't use a damaged ladder. Set the ladder on a stable surface. So ensure this on a flat, dry, and stable surface to prevent tipping. Maintain 3 points of contact, 2 hands and 1 foot, or 2 feet and 1 hand on the ladder at all times. Don't overreach. So you want to stay centered on the ladder and avoid leaning too far to either side. Use the right ladder for the job. So you want to select a ladder with the proper height and weight capacity, and always follow the manufacturer's instructions. So that's our little safety message for this time. Updates on the referral line and temporary trips program. The promotion period for the referral line, that campaign has ended. So we don't have any active social media campaigns to promote it, but we do have posters out in our system on the buses in all 4 of our business unit areas. We have the interviews that were done about the program on the UTA website, the UTA YouTube page, and then also on the Coordinated Mobility website with the community resources that has the information about the referral line. So if you ever need to link those to send to clients so they can learn about the referral line, you can do that. Christy and I are currently working with several agencies here in the LCC partnerships to begin providing temporary trips. Our hope is that we will be able to do that by April. I will be managing that as the mobility manager. So individuals will call into the referral line. If the referral line deems that they need support with those temporary trips, they will then be sent over to me to screen and send out to each of the partners that we'll be working with to provide those interim temporary trips for life critical things, medical appointments being top priority, and then things like getting to the pharmacy, the grocery store, and potentially their local senior center so that they're not isolated and they get that social interaction that they need. So we will be doing it as a pilot program, which gives us more leeway in how we can structure it and set up providing those rides. And so more to come. Hopefully by April's LCC meeting, we have actually started to implement them. And I am now going to turn the time over to Alika to talk about 5310 stuff.
Thank you. Let me share my screen. And then get you guys back up. Okay. I'm going to go over each of the grant years that we have open. The first one is federal fiscal year 2019-2020. This was from the amended year during COVID, and we just had 3 remaining that were capital grants. UT 2021-010 is now closed. 011, I am working on getting the last invoice paid for the travel trainer safety video, so that can be closed. And then the last one, 009, Turn received their vehicle, so we are closing that one. All of these grants will be closed by spring. So 2021-22, all of your expenditures need to be made by the end of June. And please try to get all your invoices in also by the end of June so that we have time to pay them and make any last revisions to the grant that we may need to do. If there is remaining funds that we need to move around or get spent, I will reach out to some of you. All invoices, final reports, and closeout paperwork is due by September. Again, we'll do the same closeout form that we did for the 1920 grant, which will be on Google, like a Google form that you just click a link and fill out, and that will count as your closeout paperwork. So it should be easy. And then me and Glenda will look over in Zoom grants and see who has not spent their funds, and we'll send out some notices if you have not sent in your invoices. And then just a reminder that your next quarter report in this grant year is due April 15th. And then moving on to the newest grant that we've executed is the federal fiscal year 23 and 24 grants. All grant agreements are now executed. All projects have started. Glenda and I worked on getting Zoom grants up to date, so your budget should now reflect the budget that's in your grant agreement. So in Zoom grants, when you click your budget tab, they should match and be the same. This will help, I think, with tracking how much you have remaining and avoid confusion about what you were awarded. Also, the internal management data has been added to Zoom grants. That's a separate tab. And there you can view your contract number, your period of performance dates, things like that. But please look at your grant agreement too, because you'll have more milestones and more specific period of performance dates based on what you were awarded. You can now start submitting invoices for this year. Some of you already have, and we have started processing those. And just a reminder, we're trying to shorten that timeline. FTA wants us spending money and getting these grants closed quicker. So this grant will also, you need to get your invoices in by June. So for FFY 23, you should already have all your expenditures within that 2023 year, and you can start sending in your invoices. And then 2024, you should also have all those spent because it's 2025 now, so you can bill for all of them. Follow the timeline in your agreement. Remember, I just said the milestones in your timeline might be different than someone else's based on what you were awarded. So make sure you read in your agreement the exhibits, which include the scope and the budget, your milestones, everything like that. They're more near the end of the agreement. And we will also send out reminders for this one beginning in June. If we look and we see there's agencies that haven't been sending their invoices, or if you're missing something, we'll reach out to you. And then just a reminder, this one, your next quarterly report is due April 10th because we moved them up 5 days to allow us more time for our reports. So moving forward, any grants will be due on the 10th instead of the 15th. Reports, sorry. Any more coffee? Okay, team upcoming events. I just want to update you internally on what's going on in our department. We will be with a federal compliance contractor all week next week who is helping us prepare for the next triennial audit. She's going to be looking at our program management plan and our guides and giving us advice on how we're doing risk assessments, site visits, that kind of thing, to help us prepare for that. And then the following week, we will all be in DC for the National Grants Management Association Conference. It's a training where they usually update us on what's going on with federal grants. They will let us know any changes with the uniform guidance that are coming down the pipeline. I'm also going to touch on some changes that were made in October and then on the next slide. So just so you know, we'll be answering emails, but we can't do meetings, site visits, or vehicle deliveries the next 2 weeks because we will be very busy, and we will get back to you when we return. And we will share with you anything that we learned that might affect you or any changes to the guidance that are coming. Some uniform guidance changes I wanted to discuss with you guys. The first one is the whistleblower protections has been updated. Now you are required as a subrecipient to have in your policies something about notifying employees of their whistleblower protections. So they're protected if they report fraud, waste, or abuse of federal funding, and they're protected from retaliation. So if you don't have any policies about this, just add something to your policies and notify your employees of their rights. If you do have a written policy, maybe just send out an email reminding employees where they can find that information. That way, if a triennial auditor asks you about it, you can say, oh yeah, we reminded them after the uniform guidance updated this section. Termination. This section just outlines clearly what we as a pass-through entity or a federal agency such as FTA, what we need to do if a grant agreement is terminated. It's more so for what we need to notify you of and what we need to include if we're terminating a grant agreement with a subrecipient. It also just restates that we have the right to terminate a grant agreement with a subrecipient if we need to. And then the section 4 requirements for pass-through entities has been updated to include more specific wording and information. It outlines what UTA must do prior to award and what information we have to ask for. Usually we do all that in our application. You know, we ask you for your SAMs and your financial reports and your certs and assurances and all of that stuff. So it just is more clear and outlines it. And if you want to look up any of these, you can just Google this 2 CFR and the number and you'll get the full, you can find the full circular if you want to read that. It also just clarifies better what our level of oversight and monitoring should be. It talks about site visits and risk assessments in a more clear way. And it also talks about how we can enforce action against non-compliant subrecipients. And if you want to see what those can be, there's a separate section called Remedies for Non-Compliance, 200.339. And that just kind of lists to pass through entities like us things we can do if someone's not complying. It's more of a suggestion of actions we can take. So yeah, I mean, these last two have always been there, but they've just updated it to be a little more detailed. And then the whistleblower protections one is new to me. I don't think it was there before. So lunch and learns. I haven't done one in a while because we had holidays and the end of the year. So I will be bringing those back. Our first one will be April 8th. And the topic will be backup documentation and submitting invoices. Since your projects have started in the new grant year and people are starting to submit invoices, I just want to do a refresher on how to gather your backup documentation, what a good cover sheet looks like, what are allowable expenses, how to read your remaining funds in Zoom grants again, and just kind of brush you up on that, especially if you have new employees that will be helping with invoices. You can send them to this lunch and learn. And we will also record it and put it on YouTube so that if Glenda has to send an invoice back or she sees a problem, she can recommend this video. That way you could just go watch it and remember what was discussed. So it'll be easier to help, hopefully. Okay, site visits. Glenda's going to update you on site visits and risk assessments, but I just wanted to remind you that we have to do risk assessments every year for every agency, even if you do not have a site visit due. And then we will send those out to you. If your rating has changed, it will change your site visit schedule. So I can't tell you yet who is due for a site visit in 2025, but once we're done with the risk assessments, we will know and we will notify you if you have a site visit coming. And yeah, Glenda.
Okay, thanks, Alika. Yeah, I just wanted to touch base with those of you who did have site visits this year. If I haven't finished following up with you, I haven't forgotten about you. I'm just not as quick as Alika, so she will be helping me finish that up. So in the next couple of weeks, you will hear from me, and we'll get those completed so that we can finish your risk assessment, so that we can notify you what your risk is and what you can expect for next year. But in the meantime, if you have any questions, feel free to get a hold of me. I just wanted you to know I've not forgotten about you.
Thank you. And then this little pie chart, this is from 2023, just to show you where our overall, all the agencies together, we're standing. So I'm hoping that this 2024 one will have some less high risk. It looks like the majority was medium risk in 2023. So I'll share that with you when I have those updated numbers. On vehicle updates, Christy will give you some updates, and Glenda if there are more vehicles on our lot that need to be scheduled for pickup. But I just wanted to touch base too on if you're having issues with your vehicle. We are aware that some of the vehicles from Davy Coach were having some issues, but we can't help you with that if we don't know about it. And we need to know if you talk to the vendor, if they refuse to help you, what's going on, so that we can make sure that those vehicles are working. If they're not working, then we need to try and help you get them working. Okay. Christy?
Okay, when I'm looking at the new grant, well, I'll let Glenda talk to United Way. They have a vehicle. They know that. They tried to get it and we had a blizzard instead. So it looks like, let's see. So on the transits, because we have, those are Turn. Turn has requested a couple of 88 transits, and they've already heard me tell them that those are going through the order process right now. And I know that the document is getting processed to the board. That's been happening today. So hopefully that order will get in quickly. And again, 88 transits will show up hopefully by end of summer, early fall. Payson City, you are on. I am going to put in, hopefully tomorrow morning, a requisition for your cutaway. That is coming from a local vendor, and I'm hopeful we can get it in within 60 days of me putting the rec in. We have a lot, sometimes it just takes a minute, but just know that. And that's all the vehicles for Provo Orem area right now, but that's status on all of that. Reach out if you have questions, and I'll be in touch probably I will reach out to you, Payson, probably once I'm in the position to actually purchase the cutaway.
Okay, thank you. Glenda, did you have anything you needed to say about vehicles?
No, we'll just need to reschedule with Utah County. I mean, I don't want to jinx us and say like I know for sure that we're never going to have like a weird snowstorm again, but I feel confident that the weather is cooperating. So just get with me and we've got it ready for you.
Okay. All right. If you have any questions, you can reach out to me or Glenda. These are our email addresses. And like I said, we'll be kind of out of the office the next 2 weeks, just busy. But if you have anything urgent, we will be checking our emails. Okay, thank you.
Thanks, Alika. And actually, I will not be out of the office. So if there's something urgent as well, you can reach out to me because I will be available. So, all right, we are going to move on and talk about the Human Service Transportation Plan. So most of you are aware that we have to update this every 4 years, and this happens to be the year. So we will just be breaking it down over each of the LCC meetings this year by section and walking through those things to address them and get updated information from you as our community partners about the issues that you face so that we can make sure we address everything. So Christy is going to show her screen. And then the first area that we're going to be looking at is the funding gaps. So I will go over all of those bullet points and then we will revisit them one at a time to update them. Thank you, Christy. So the first funding gaps are identified and they refer to funding needs of human service transportation providers to be able to run their services. So the gaps included are limited funding sources for providers. Providers are often dependent on limited government grants, donations, and public funds to run their services. Providers compete with each other for these limited resources. The second is local match for grant awarded funding, which is often difficult for organizations to budget for. So even when an organization is awarded grant funding, those awards often require match funds from the organization. Most specialized transportation providers have very tight budgets, making the match funds difficult to allocate. And often those match funds are taken from some other area of need within the organization. Then we have maintenance, fuel, insurance costs. And these ongoing costs for vehicles are expensive and can often rise with inflation. Not enough funds to pay for operations. There are times when providers have vehicles sitting idle due to the inability to pay for operation of the vehicles or to hire drivers to cover the routes. This has recently become particularly challenging as the COVID recovery has caused a scarcity of operators and a demand for increased wages. More demand on service as society ages. As more of society ages, more individuals become reliant on transportation services. And if additional funding does not become available, those needs for society do not get met. More trips needed for day program clients because of new Medicaid laws. The federal government passed legislation, which is called the Home and Community Based Settings, excuse me. So the federal government passed that legislation that requires more community access for DSPD clients. It is an unfunded mandate, meaning that this new requirement is mandatory, but no additional funding is provided to cover that additional service. And then some clients cannot independently ride public transportation. So though public transportation can help ease the transportation burden for some specialized transportation providers, there are clientele that will never have the ability to ride the public system. So we'll go back now and visit the limited funding sources for providers. And we would love and value input from those of you who are affected by this. And what you're experiencing.
Sorry, I'm unmuted now. So some people who come to all of these, this is getting redundant, but that's okay. We're gonna fill in our gaps and sort of help lead you guys along. So let's see, do we have anybody? I know that Turn does this. Sandra, do you guys use Medicaid or do you just use DSPD funds?
Neither.
You don't use either. What funds do you use, can I ask?
Comes from our state funds.
Oh, and what from health?
From
From what?
DWS, Department of Workforce
Oh,
Services.
Department of Workforce Services. So you're using DWS funds. Do those funds, out of curiosity, cover the cost of the actual transportation that you're providing?
We build that into our budget that we get each year. So we allocate a sum for our vehicles to be able to maintain and keep, fuel and maintain. But our drivers, we fund 2 of our positions out of that state funds, but they're just part-time drivers.
Okay. All right, I'm going to make a note. Do they pay you? Are they slow to get you paid? One of the gaps we've stumbled upon through our new conversation, because these conversations change as time goes on, was that Medicaid is very slow to. They're a bit slow paying their bills. Is DWS, or are they good about?
No, that's just the money that's allocated to our center.
So you get a pot of money?
So we get a certain amount each year.
Okay.
And that's what we build into our budget.
Okay. So that works a little bit differently. Is that the only state funds you get? Do you apply for other grants besides 5310 out of curiosity?
Just the UTA funds is all we other apply for. So
okay. I'm just making note. Let's see. I'm trying to get all the subtle nuances of everything. Okay, and we had sort of talked about, I want to look at that because there was some new stuff in that. I'm sorry, I'm juggling between things. Let's see. Are there less opportunities? We sort of talked to Turn about this in the other meeting, and Melissa mentioned it. She does veterans, that they're getting less funds from sources that they used to get. John or Gary, do you guys get funds from other grant sources? Does United Way, are you getting less funds? Do you know anything about that? Gary and or John?
We're not. The only thing was that 5310 grant for the through this program right now. There's not really anything else.
Does your United Way get funds directly from National United Way, out of curiosity?
I know they do, but I'm not sure if it goes towards this program at all. But I'm not sure how much it is nowadays. So
okay, I'm just going to make a note.
And Christy,
yes.
Our agent, we haven't had any experience. Luckily, we haven't experienced any budget cuts. But usually, if we get less funds, it would be through a budget cut.
Okay.
But we haven't experienced that, thank goodness. So.
Okay, that's good. That's good to know. Cool. Is there anything else anybody would like to share about limited funding sources? Oh wait, I have one for I'm sorry, is it senior grandparents, Cara? So do you get your money from State Health and Human Services? Does it go through MAG? How do you get your funds?
Yeah, it goes through MAG. All of our transportation funding that we get through them. We get the Title 20, and then there's a couple other small small amounts that we get through them.
Okay. But it has to go through them first and then it comes to you. Do you get that in a lump sum or do you get reimbursed too?
We get reimbursed.
Okay. It's a reimbursement program. Have there been any cuts to that, or are you still getting what you've gotten in the past, or?
We just submitted our grant applications. I don't think they've approved them yet. So I know that they're looking at them, but so I don't know that answer.
Okay, so you have to apply for those funds though, as if it were a grant?
Yeah. The Title 20 we do.
Okay. It's very interesting to learn all the different, to me it is. It might not be to everybody else.
Going
to
on.
me, it's interesting to learn about. There's all these nuances of funding out there that if I don't dig, right, then I don't know. Okay, that's good to know. Thank you. Okay. Any other feedback or something we haven't covered? Let's see. You're okay, Tom. That's fine. Anything else on this topic? Limited funding. Okay, because we have quite a few different ones in here, so I think we'll be okay. This is okay. So local match. So as we all know, even though, oops, I don't want that. Sometimes a match, right, can be a burden. Oh, usually Tristan, I don't know. Tristan, do we reread these? I can't remember. I think you've been rereading them for me, or at least rereading the title.
I have been, but you're fine.
No, go ahead.
Okay, so local match, we just talked about how that's often difficult for organizations to come up with. So I'll let Christy kind of talk about something that we're hoping to see happen and potential changes for this area.
Okay, so one of the things, now I'm interested to see if you guys agree with this. Davis Weber Partners were saying, and I think Phil was one of those, that a lot of times it's easier to have the match for the operations, but it's hard to come up with the match for, say, a vehicle. Is this true for you guys? Does anybody know? Like Gary, what about you guys? Or John?
Sorry, say the question
Whoever's
again.
on, Gary. Okay.
Sorry, say the question again. I missed it.
So they were saying up in Weber Davis, some of the partners were saying that it's easy to come up with a match for operations, but it's not as easy for like vehicles.
Yeah, that is true. That's where we had delay on picking up that vehicle.
Okay.
I mean, because you come up with, like those vehicles are so expensive nowadays. So, we're dropping almost $20,000. That's a huge lump sum to come up with, in one shot.
Right. And I think I meant to ask that, like, I think I meant to mention that, but I get sidetracked because I'm, typing up notes as we talk, make sure we have the information. Yes, the increased cost has not been our friend, has it?
No.
I'm just going to put that's a barrier. Okay. So, because yes, it's gone up a lot. I mean, what we didn't even used to pay, what we're paying for cutaways now is more than I mean, it's over $100,000. It's insane.
Yeah.
And our
almost
trend
doubled.
Yeah.
Well, and sometimes,
yeah.
Christy,
go ahead, Sandra. Yeah.
Sometimes it's taken us several years to come up with the match because we have to do it through fundraising events and things like that, and other ways and means to get the match, or at least for the vehicles.
Okay.
And then just through the operations, we have to also have it in our budget to be able to match those funds. And sometimes we don't have that extra to be able to do that. So it takes a little bit for us to build in that capacity.
Okay. That's good to know. Okay. Oops, sorry. Okay, that's good to know. No, this is really great. Because everybody's different, right? How you're handling your situation and what you have going on. Right. Anything else about match that we're not thinking of or knowing? Oh yeah, so keep it so here's something to consider or think about. A lot of you do in this group, we have a little bit more representation, well, percentage wise, but ERSTA, a number of you belong to ERSTA, which is our state transit association. That's sort of where we bring together the urbanized and the rural side. So UTA, we manage the 5310 funds for the urbanized area, and UDOT manages those same funds for the rural areas. And ERSTA allows us to sort of come in together and possibly work together, right? And bridge that gap of being separate. And so anyway, that being said, ERSTA is trying they're always trying to be proactive, but a little bit more proactive, maybe in some legislative support in the future. So we're looking at helping advocate for, I don't know how else to say this, advocate for the state making up the match for our partners out of state transportation funds, possibly TTIF funds. So that way you wouldn't have that match that you would have to worry about as much. I don't know that, I think it's sometimes hard for government to know the reality of, I think there's two different theories, right? I think there's a theory of there's, these subrecipients should have some skin in the game, so they should have to put something towards these vehicles. On the other hand, the reality is, well, you already are doing that because you're committing to operate those vehicles and you pay for ongoing maintenance and stuff. But to come up with, like Gary is saying, right? And for any of you, when you got $100,000 vehicle, well, that's a 20%, $20,000 match now. That's a lot of money coming out of your funds that you just don't have. And I don't know that they, especially with the increased cost over the last few years, I don't know that, government's really thinking about that or looking at that. And so I think at least locally, if we could get that from state transportation funds, which we do have, I'm hopeful that would help all of you. So we'll keep you in the loop on that and how it might move forward. But please be involved with ERSTA, because like I say, the more, the better. We can, we're stronger with the more people and organizations we have in ERSTA. So that's that update. Is there anything else on local match?
No, Christy, that would be very helpful. For vehicle match.
Okay, good. And I think, to be honest, I think vehicle match is easy. I wish it wasn't for operations because, right, we have to operate the vehicles we get. I mean, sometimes that's hard too, but operations, unfortunately, that's a bit of a moving target. Whereas I think match on a capital project is not as moving. I mean, I guess they move a little bit because there always can be price increases and stuff like that. So who knows what that looks like, but maybe it covers, if we get ongoing funds, say for instance, from transportation money, maybe that's 20% always for the capital projects. And then what's left over can go, people can split for helping out with operations match. You know what I mean? So, but yes, I agree. Yes. So we will make sure everybody's kept in the loop and we are going to work on that. There's other agencies across the state that really want that to happen. UDOT is very interested in this happening. So hopefully Strength in Numbers will help that get passed here in the next couple of years.
Yeah, Christy, that's one thing. Like with our, I mean, we'd like to be able to do another driver, but it's just that right now we don't have it in the existing budget to be able to support the other 50% match. So that's something, that's why we can't get another driver, but we do need another driver. So.
Okay. That's good to know. And I understand that completely. Anything else under local match? Okay.
Okay. The next one is maintenance, fuel, and insurance costs of vehicles. In the other UZAs, they have mentioned that lift maintenance has become an issue. So if there's any additional maintenance costs that are not addressed here, please throw them out to us. Christy, I'll let you take back over.
Okay, so real quick, I'm just seeing some of the things that came up under this topic. And Trista is correct. One of the things that did come up is that the lift maintenance. And so I talked to Tracy about this earlier today. We're going to talk to Ersta. We're going to have another training and then also see if there's a way to get some additional certified Braun lift inspectors. Are most of your lifts Braun for you partners? Do you know? Phil,
Yeah.
what do you do?
For
Okay.
turn it is.
Yeah, those are too.
Yeah,
Okay.
We've
Okay, good.
switched over the last 2 years, and we primarily have bronze lifts.
Okay.
That's
And you,
for us
Gary?
too.
Same here.
Okay, Sandra. Okay, cool. Okay, good. So it sounds like the Braun is the bigger one. So we'll get working on that at least through Ersta, and then maybe we can get some of your organizations with a certified Braun person, and then the other orgs can bring their vehicles over too and sort of cut down on that cost, because I know it's costly to go in and do that lift maintenance. Is there other maintenance issues? We sort of talked about in the others, like, you could get cameras, GPS, those are capital that you could apply for. Other maintenance.
I wanted
kinds
to
of
ask real quick,
things.
Gary, is Sergio already a Braun certified lift person?
Yeah.
Okay.
Is he really?
Yeah. Well, let me take that back. I was told he is. I've never seen any certification, but he knows how to fix them. So how about that?
Okay.
So do you take your vehicles anywhere for the certification, or do we just have Sergio sign off on that?
Sergio fixes most of ours unless it's really bad. Then he takes them up to Lewis Brothers.
Oh, he still does take them to Lewis, though.
Not very often. I can't remember the last time we've taken anything up there, but like last time there was a big recall, like literally Lewis Brothers gave us all the parts and Sergio fixed it all. So we might just go through for parts for the repairs.
I just was wondering if he might be able to sign off for the Utah County partners like Sandra and Phil down there on their lift maintenance to cut some of that expense.
Yeah, I had to check his certification to see if he would be authorized to even do that. But,
okay.
The
Would you
cost
check
and
into
time on
that?
that would be a little rough. So
Trista,
yeah,
you might want to check with Jason. I think when he set up that training before, I don't think Braun, when they did the training, would provide a certification. It was more to do like spot checks, like all of the regular issues that come up. I don't think they will provide a certification. I think you have to go through a certified dealer for that. But check with Jason on that.
Okay,
would you?
I'll follow up with Jason.
Okay, thank you.
Yeah, we'll check on that, because that's a costly situation. So we'll see what we can do on that. I think we're gonna reach out to Ryan Taylor too. I don't know exactly what they do over there at Riverside, so I'll reach out to him too.
So let me tell you, when the reason it filled up so quickly was they started the class and word spread how good it was, and they just had all these people joining quickly. So we just need to set it up again. It was a very good training. So
okay, cool. Thank you, Tracy.
Tracy, can we set it up as an invitation only where we hand select the people that join first?
Yeah, it's probably a good idea.
Okay.
Yeah.
Great. Thank you.
Helpful.
Christy, we've been doing our van maintenance up at Mobility Solutions in Salt Lake. So, but that's just one reason. But if we could do it here in Utah County, if Sergio's able to do it, that'd be great too.
And I think, do you know what does Mobility Solutions charge? Do you know for your lift maintenance?
I'd have to check into it, and I can let you know.
Because I'm wondering if they cost a little bit less. I have heard of them, by the way. So yes, I believe that yes, they are another one, and we just sort of forget.
Yeah, I'll let you know.
Okay.
Out of curiosity, could Gary apply for grant funds to get Sergio certified and make that a community partnership since grant funds pay for it? If he's not already, I'm just throwing some ideas out there.
I mean, it helps with the maintenance of the vehicles.
Right.
We'd have to look if grant funds are eligible. Otherwise, maybe we can do that through Ersta. Let's see if it's possible. and then we'll see if we
Okay.
can find the funding.
Yeah, so my concern on that was, I'm not opposed to it. I just have to check the workload, like how many lifts. I mean, because he's already servicing, our fleet of vehicles, so I'll make sure there's enough time for him to be able to handle that extra
Sure.
workload and the cost involved with that. So
I don't think it
Yeah,
would be
that makes
too
sense.
terrible. And then if we just did I mean, we'd have to look at it. No, I get where you're coming
Yeah.
from, Gary. But also too, if it was just like a nominal fee, as opposed to, because the dealerships can tend to charge quite a pretty penny for this. Because of course, we don't want him working for free or anything. But on the other hand, if it was a more fair cost, that would be great.
$1 million.
So, right? I don't think so, but okay. Anything else on maintenance issues?
Like you got it covered.
Okay. All right, Trista.
Okay. Not enough funds to pay for operations. So again, as I read earlier, sometimes vehicles are sitting there because you can't afford to pay to operate the vehicle or hire drivers. So we would love to hear what you are facing with that.
Do we have anybody with sitting vehicles per se now, or do we seem to have enough operators? Do people have enough operators for what you have down there?
We do here, but one of the biggest problems now is the pay. I mean, so we've had to increase our pay. Like when I first started, I mean, we've gone up probably about $5 in the last 5 years, which is a huge increase. But at the same time as I'm paying the same amount as what McDonald's is paying people. So we're helping people at risk, ADA compliance, that kind of stuff, and we're paying the same much amount as a high school kid working. I mean, my son still works at a restaurant, and my drivers make the same amount as he does. It's ridiculous.
Sure. No, I get that. I mean, that is one of the things on here. Yes, that the pay for these operators is oftentimes not sufficient. One of the things also, say for instance, like from Susie up north, things which is still operations, right? Which is okay. Well, like scheduling software, that can be expensive. I don't know if that's something you guys need. Well, thank you, John. Yes, at least they get health insurance. Are there other operations? Because you're right, that is still an issue. The pay is definitely still an issue. I sense, at least from UTA's perspective, we seem to be getting more applicants when we have job openings. So is it getting a little bit easier to hire? Because it sounded like, Gary, we talked about that, and it sounded like things had gotten better for you too, at least down there.
Yeah, so I put a job out a month ago, and we had 100 applicants.
Whoa!
Oh, wow.
So it was great, but I mean, once again, we raised our pay scale. So I mean, just sharing, we pay usually between 16 and 18, which is not great, but 100 applicants. How many of those people are just applying to keep blah blah blah, all the drama behind it? But I mean, we interviewed probably about 20 people for the whole the whole thing, and how many people those actually showed up is a whole different thing. So.
But it's better because for a
I was
while
there
there
when I first started. I mean, we couldn't even get 2 or 3 applicants, and then those wouldn't even show up. So the pool is definitely better, but I think you're going to get a better quality candidate if we get a better pay.
It's been better for us as well, but it's retaining the drivers because they're always looking for higher paying jobs.
Right. Okay. That's good to know too.
Yeah, and the problem with Turn is that our retention is the highest it's ever been, or not the retention, the turnover is
The turnover.
has been the highest it's ever been. We're not used to that, but we see a lot of people leaving because of higher pay.
Yep.
Here at Utah County, we struggled a little bit with the foster grandparent program because it's limited hours, and it's kind of stuck in the middle of the day. Just when they're driving, we pick up volunteers from their home and take them to school, and then bring them back to their homes, and so they're driving for an hour and then they're off for a few hours and then they're driving for an hour, and nobody wanted that kind of schedule. It's kind of hard to.
Gotcha.
Yeah.
It's like a split shift. Okay. And you pay your drivers, Cara?
We do. We have two. We finally got two, and they're both retired, and so it's great that
Okay,
we're there.
so you have operators, but the problem is, it sounds like they're doing what we call at UTA a split shift.
Mm-hmm. Yeah.
So there's a gap of time in between when they're operating.
Yes.
And that is a problem. We even have that problem. UTA's been working really, really hard to get as many of those split shifts out, because you're right. People don't stay long if that's their permanent.
Yeah.
Right? Their permanent schedule. They do not like that to be their permanent schedule. Okay. That's a good note. That's a good thing to know too. Anything else under operations funding issues or operation issues? Okay.
Okay. More demand on services as society ages. Have you guys seen an increase in demand, a decrease? In our last UZA, one of the aging organizations mentioned they'd seen a slight decrease in demand, and they weren't sure where that came from. So just curious as to what you guys are seeing in your area.
Definitely an increase.
Increase.
So our Utah Valley Rides program is booked out usually about a week at a time. I mean, so people calling in, on a Mondays might get lucky and get a ride for Friday. Might.
Oh, okay.
Okay.
Now,
Actually,
what
about 2 weeks now.
do you guys, John or Gary, do you guys have a theory? Is it just more people know about it? These people can't afford other means of transportation, don't have the ability? What do you have?
It's a combination of all
thought?
of those. It's a combination of all of those. We get people for different and various reasons. They're aging up, so they now qualify because they're the proper age. We get other people that just find us new. So
Okay. All righty.
Christy, we're also
Yes.
seeing an increase in requests for our on-demand, even with our limited ability to be able to provide on-demand. We're getting more and more that are starting to contact us wanting on-demand services. So
When you say on demand, what are you doing exactly?
we're just
I'm
taking
curious.
them. We're taking them to different community appointments that they request.
Oh, okay.
That's
And what are
outside
your
of
hours? Do you have particular
it's just during
hours,
our
I'm
work
guessing?
hours.
Okay.
That's why it's low. That's why it's limited. But even though during the day hours, we're starting to see more and more people asking.
Okay.
From before, it was pretty slow there for a while.
Gotcha. And then, so this is probably a good spot to throw this out there, which you guys know, because I've been talking about for some time. But so in April, that new on-demand area is supposed to go live, Sandra. There you go. Okay.
Yeah.
Is that going to be, because I believe Ability First is in that zone, aren't you?
Yes, we are.
Okay.
We're very excited.
I was going to say, is that going to be helpful for you? I hope.
We hope. And we're going to encourage people to use it. So we're we're definitely gearing up for that and hoping that we'll have a lot more people that will start using that, and so that we can, make sure that we can see that there's a need for it down here.
Okay. Thanks, Tracy. No, that's great. Because I'm really curious. Like Trista said, we're going to be doing temporary trips here. Hopefully, my goal is for April, we can start those. We have funds that we need to spend and sort of run a pilot down there, see how this is going to work. But we also want to try to stay out of that on-demand area. In other words, we would prefer, like you say, if people are in that area, we can send a travel trainer that's free, walk them through how they could use that service as since they have it. And especially if they stay within, and if they stay within the zone, they're just going point to point. But of course, it also, what's nice is it'll take them to our, like to the rail line, to the station. They can get on UTA services also. So hopefully it does definitely help with some access down there in the Provo area.
Yeah.
So, sorry, where are we? Okay, so we add more demand. We're talking about more demand. We don't really, this is another hard one. Like, you know, Utah County is very different when it comes to how they do their aging services. And so Cara or anyone else, or Payson, you would be good. Are you seeing increases in requests from aging adults?
Yes.
Yeah, I know with like Payson, we've seen a higher increase. Our van, we typically only use to come and go from the center. But
Okay.
even that, like, a lot of my seniors have let me know that their children have taken their cars away. Right? So, like,
Okay.
because of driving, like, because headlights are a lot brighter now and, like, all of these things, that plays a role in them being able to get to the center because they simply just don't have a car anymore.
Okay.
So we've seen an increase every single day in the amount of people we bring to our center, as well as we go on like little outings, and those are completely booked every single time, just because it's the only time they can get out because they don't have a vehicle.
Okay, that's good to know.
So with
Then
our
you
senior
can-
companion program,
go ahead,
they go
Mhm.
out and do limited transportation with clients, and we're getting more and more calls from people who just need transportation and they don't want the ongoing service. They're like, I just need a ride to the doctor on this day, and we just can't do it.
Gotcha. Okay.
So
that's
Kara,
good to know.
those kinds of calls are going to be the ones that maybe you want to refer to me for those temporary trips to see if we can't help fill that.
Definitely. We would be thrilled to be able to give
Okay.
somebody some answers. I always hate saying no to people.
Oh,
They tell you their
absolutely.
story and it's so bad, and I'm like, I would come pick you up if I could.
Right.
Yeah. Nice. Okay, any more feedback? That's all very good feedback. I mean, most of us realize, yes, we have an aging population, even here in Utah, even though we're, I think, second to the, are we youngest still or second to the youngest? I can't remember. I lose track on these surveys, but we'll say youngest because we're typically are. Even with that, though, we have an aging population, right? Just like every other place in the state, I mean, in the United States. So it's something that we, you know, definitely need to address. I know that there's a decent amount of food insecurity down in your area, seniors that need Meals on Wheels and stuff, and there's not funding. And so these are things that definitely concern us. We want to try to fill those gaps. And I think now the Meals on Wheels is all done through MAG, is that right?
Yes.
Okay. Okay. Thanks, Jay. Anyway, so the Meals on Wheels done through MAG. Okay. And are their drivers all volunteer, some paid, some volunteer?
I believe it's all volunteer.
Yeah.
Okay.
Yeah, based off my knowledge, it's all volunteer. And so sometimes if they don't have volunteers, I'll have to go out and make those
Oh, okay.
deliveries as well. So that is something we would use the van for as well, to make deliveries.
Okay.
So here in our office, I and my 2 program assistants all volunteer to serve Meals on Wheels, and we go once a week.
Okay.
And do that ourselves just to help out.
Well, I mean, that is good of all of you, because yes, that's a hard one.
But there have been, especially recently in the past couple months, we get calls at least 3 times a month where we'll ask to cover another route because they don't have enough drivers.
Oh, geez. Okay.
Yeah. I know, like, especially in our area, I think it's just because we're like the south end of Utah County. It's really hard for volunteers to get down here, especially if there's like weather.
Okay.
And so a lot of the times, seniors that do drive, or me or one of my coworkers, they'll have to step up and help get those meals out too.
Yeah. I think they're desperate for drivers because I was at MAG yesterday and on the front desk, the first thing you see is you look like a Meals on Wheels volunteer driver. I mean, that's a big thing right now.
Yeah. Okay. Making notes. This is all good to know. We can add into each one of these. Anything else under more demand for service? Okay.
All right. The next one is more trips needed for day program clients because of new Medicaid laws.
Okay. Sorry, I need to just move this and then we can. Sorry, I typed under the wrong thing. I'm just changing my header so I know what I'm doing. Okay, so now turn when they've talked before, right? Logistically for them, it's just they just have to do more of group kind of things because it's just impossible with the funds and the staff to do a lot of one-offs, right, Phil?
Right, it is.
Okay. And then Sandra, do you do much, or are you strictly just taking people more like to job things and that kind of thing? Or does your organization do sort of these community day trips for persons with disabilities?
Well, kind of both. We take them to medical appointments as well. I don't know, we've done too many. We've done a couple, maybe employment, but it's mostly just appointments that they have out in the community. And then we do our activities and in our classes here at the center as well.
Okay. Okay, and then classes at the center.
Mm-hmm.
Okay. Anything else? I know that's a small piece of our partnership down here in Utah. Well, at least represented. I don't think it's a small piece. I think it's just not represented. I think there's more groups down here that do some of this transportation, and we try to get them to come and try to get them to apply, and it doesn't really happen. But that being said, is there anything else on day program trips that we have not? Let me double check on this one. I just want to see if we okay. There's not a lot to add from the other areas on that. So okay. Any other feedback on this particular gap? Okay.
Okay, and I believe our next gap is I was hoping I could remember without seeing it, Christy.
Oh, sorry.
No, you're okay.
Let's see. We had we did that day program. Sorry. We are on public
not being able to
transportation.
independently ride public transportation, just because the clients don't have that ability.
Okay, so
how many of you have individuals that fit into that category, and what, if anything, plays into that?
People just don't have the skill set. They're not comfortable because they've never done it before. It takes $2 to go try it, and another $2 to come home after you're done. And Front Runner costs even more. And if you don't have the transit app or you don't have a card, because let's face it, you're not going to buy that card if you're only going to try it out and see if it works. And then, you're spending $8 or $9 to do that if you're going up from here down here to Salt Lake. So
now, travel trainers do come out and can train, and they usually have passes to cover that fare while they're teaching them.
Mm-hmm.
Right, but the problem is finding the individuals in a large enough group with a need that's greater than, oh, I just need to go there once, and then I'm done. So I don't care after that.
But
yeah, I think for us, like, the technology aspect is really scary to a lot of the seniors in my area.
Okay.
But also just like like you said, like I don't want to learn something if I'm only going to use it once.
Mhm.
Like my daughter can't take me this one time. So I just would rather not go because I don't want to have to learn it and then not remember how to use it anyway in the future.
Okay.
Okay. Do you now, is access, I'm gonna, is access an issue? You guys do not have a lot of coverage down there as compared to some of the other counties.
Yeah, we don't. I know the front runner is planning to head all the way down here to Payson soon, with the new UVU campus opening up or being built. And so a lot of seniors have thought like, oh, well, that might be nice. But a lot of them get scared to do it, or they tell their friends, hey, we should do it. And they're not going to do it by themselves. So if they don't have a friend, they have access if they really wanted to, but no one wants to go to a party by themselves. And that's how it kind of goes like for them.
Yep, I get that. Let's see. Okay.
We brought that up before, John.
Yeah.
I think it's a great idea. I've actually spoken to someone at Salt Lake about that idea because they did. It's just about getting maybe some city or state funding for it because they did it for students in Salt Lake. And the money, most of that money, some of it came from private donors, but most of it came from the school district. The school district agreed to set aside money for the budget. So I have talked to someone at Salt Lake City about trying it in Salt Lake, and they are really interested in trying that. But yeah, it's just about getting the funding, I think, to offer that. But I think it would be a really successful program if seniors got free passes.
Yeah, valid. As cost as always, we're going to get to that.
So here in Utah County, it's been, well, when Frontrunner first came to Provo, we did an in-service training with all of our volunteers, and we took them up to Salt Lake and then had lunch and then brought them all back. And it was a lot of work for us to get all the seniors there and make sure that they all came back with us. But I have quite a few now that actually ride it because they experienced it and they had somebody who could navigate it and tell them how to get on and off and what to do. And so, I mean, it was great for us if you can, like you said, find a group that can go.
Sorry, I forgot to mention that I was responding to what John said in the chat. I realized it sounded like I was talking to myself. John said, what about free fares for people 65 and over? And I was talking about how I have spoken to someone at Salt Lake City about that idea in the past.
I agree, John. I also, yes, if I have to go downtown, I take the tracks. I don't have to, well, sometimes I'll take Frontrunner, but usually I'll take the tracks because first of all, downtown's a mess. And second of all, there's nowhere to park. So for those reasons, if you can, yes, it is a good situation. And you're right. Hopefully, yes, the train gets down to Payson. Hopefully I'm excited about the on-demand, at least in some areas. On-demand supposed to also come online next year for the north area, like that Lehigh, Saratoga Springs, Eagle Mountain area. Because as some of you know, that's a huge issue. Because they're way out there. There's no service. It's costly to do service out there, but hopefully we're tackling that. I know we're tackling that at UTA. So that should get better. Keep in mind, and we'll talk about this more as the on-demand comes on board. Again, if you know of people that possibly could use that service, but they just need training, please reach out to us. We have travel trainers. It's a free service. They'll teach them how to use that service. And even if they can't use an app, they can call into that service. If they're more comfortable doing that, they can call and arrange for a ride instead of using a phone app. So we do try to make it as accessible as possible. And like I say, it's particularly good if there's a point to point, if they're within point to point within that area, like if their homes in that area and their doctor's appointments in that area, makes it really simple because then they don't even have to get on, it just takes them point to point. And
Gotcha.
you're right, John. Senior centers is probably not a bad idea. It's for us to get the travel trainers working with you guys to sort of help teach these seniors how to use our services, and particularly then the on-demand. And we could definitely work with you to arrange that. We did that for the senior centers down in the South Salt Lake area. That was our first on-demand zone. And so they went out to like the Riverton, Draper, the different senior centers, and I think they were at lunchtime, but did a presentation, helped them walk through how to use the mobile app, did individual trainings when people asked so that they could start learning how to use that in that area. So definitely we're happy to do that. Okay, anything more on public transportation? All right, Trista, we'll see what we can get through on cost.
Okay. Do you want to hit SB 195 and then go back to it, or do you want to keep going?
Yeah, I could do that because, who knows? That might suck up the rest.
Right.
I tuned the gap. Okay, so just an FYI, so most of you are probably aware it's the legislative session right now. There is a bill with a study in it. It's SB 195. It's sponsored by Senator Harper. Senator Harper is the chair of the Interim Transportation Committee and the Senate Transportation Committee. And so we report to that committee fairly regularly. Our department does directly. Senator Harper is always quite concerned about specialized transportation and making sure our seniors and persons with disabilities are getting the service they need. So, and he, I think, is fairly aware of sort of our siloed funding, right? The different funding streams and the cost of transportation for all our different organizations to be doing transportation. And so he has asked for a study in this bill. I'm assuming it'll probably pass. There's no fiscal note on this bill, so I don't know why it wouldn't pass. The study is it says in the bill, the department and a large public transit district shall jointly study programs offered by government entities related to human service transportation, including coordinated mobility services, paratransit services, non-emergency medical transportation, human service public transit fare programs, youth transportation programs excluding yellow school bus, other similar programs provided or coordinated within the boundary of the large public transit district. So this study will be specific to the urbanized areas for specialized transportation that we all do. And at the same time, there's a study going on the rural side, but let me finish describing this. So the end goal of this study, it says the study shall evaluate strategies to consolidate the transportation services described to improve efficiency and service. So him and the committee are particularly interested to see if there's a way, right, to, for lack of better terms, just like streamline this service. Is there a way to bring it under one umbrella, to consolidate it in some way, bring the funding streams together, but get the transportation taken care of for all of your organizations and your clients. And maybe you're not having to do transportation as much, if at all, anymore. So it's just something to think about. We'll keep everybody aware. Your organizations will be involved in the outreach for this, and it'll be similar to sort of what we're doing. I'm sure they're going to ask for gaps and stuff, but some of the requirement of the bill is that they will look at existing plans to see what we've identified as gaps. And that's another reason why our plan, the local coordinated plans, are important. That being said, so just keep that in mind. On the other side of the house in the rural area through IRSTA, the transit organization I talked about, IRSTA requested some funds, so UDOT awarded, and then UDOT is heading a plan very similar to this for the rural areas. And so I'm hopeful, I see at some point that these plans will sort of intersect at some level, because these rural areas have a situation, and like, for instance, Payson's probably in this situation a bit, even though you're in the urbanized technically, right? What if when you have somebody who has to get over to the Utah Valley Hospital? Well, that's not a short trip, right? Like, and these other areas are even worse. Richfield, like lots of times, right? They have to come into Utah Valley Hospital or they're going up to the U. And how are they getting there? The VA is the same problem. And so they're supposed to, part of their study will be looking at not just what they can do within those communities, but also how they can connect into the urbanized areas. So that's where these two plans will probably intersect and overlap a bit. So just be aware of all that. And I'm hopeful that we can come up with some really good solutions for your organizations and the people you serve that just helps everybody and makes it more simple for your customers and clients, to get to where they need to go. Okay. Did I cover everything on that, Trista?
I believe so.
Okay.
So real quick, I will just hit our last 2 points and then we can go to cost until the end of our time. So as Christy mentioned, she's talked about IRSTA a lot. Some of you participate. We would love to see those who don't join us. But our next IRSTA conference is scheduled in St. George. The current dates are September 10th to 13th. There's a slight chance that will become the 10th to the 12th. We're negotiating the rodeo portion of that, and we may move it to the middle of the conference instead of Saturday morning. So watch for those emails, or if you haven't joined IRSTA, go to the IRSTA website and join so that you get the updates on that information. And it will be posted soon to the IRSTA website to register for that. I will send out an email to all of the community partners when that happens so that you can be aware. But we've got that coming. And then our next meeting will be held in person on Thursday, April 24th, same time frame, 2 to 3:30. And it will be held at the Turn Community Services Provo offices where we have held them, last year. And we are extremely grateful to Turn for allowing us to use their facility. So thank you.
We will just probably end, we'll end a couple minutes early.
Okay.
So, but I just want to throw out, we'll get into costs next time. We'll keep going through these gaps. I really appreciate everybody participating and being patient with me, digging into some of the weeds. It's just, we've been together for so long, and I'm really interested as times change, and also just the more and more, of course, I know about your programs. It enables me to dig deeper for your issues and the gaps and your concerns. And again, I really appreciate your participation. The only thing I want to mention on cost is we had something come up, but we'll talk about this in detail next time, about more a lot of organizations and people don't realize what reduced kind of fares that we do have. So we are going to invite somebody from the fares group to come and do a presentation. I mean, it won't take the whole time, but a brief presentation about the different fares and different programs that we have, in hopes that helps your organizations and clients with affordability. And then we'll get into the gaps on this the next time.
Great. Thank you, everybody, for being here. We appreciate your input. If you did not put your name and organization in the chat, if you can do that real quick before the meeting ends so we can track attendance, because that does get tracked for grant application cycles. So otherwise, we will see you all next time.
Thanks again, everybody.
Thank you.
Bye.
Thanks. See ya.
Bye.
Bye.
Thank you.
Who's the last one to leave?